Okie dokie, let's take a look and make sure everything is looking good. And once we've done that, we'll start streaming for the day. Let's try this again. All right. Let's just make sure everything sounds good. Sorry about that. Here we go. Here we go. How do we sound? Okay. It's sounding good. Okay, that sounds good. All right, let me just share this on YouTube and Twitter, and then we'll get going. All right. Here we go. Just going to find the link. Give me just a sec. Almost there. Okie dokie. Here we go. Get that over there. Get it over here. Just a sec. Just going to share it on Twitter and then we'll get going. So sorry. Okay, almost there. Here we go. All right. All right, we are good to go. We are now shared on Twitter and YouTube. So welcome, welcome. Good afternoon, good morning, good evening, everybody. Good to see you. Glad you're here. Welcome to yet another episode of UnShrink Me. I think this is episode 49. So far, so good. Doing good. For those of you who are brand new, this is a weekly podcast dedicated to everything mental health, especially everything related to the appropriate and skeptical criticism of all services mental health, be it psychiatry, psychology, mental health therapy, coaching, all that stuff, with a special emphasis on whatever is trending right now, especially online, because that's where people get their information, unfortunately. So the idea of this podcast is just to promote a more accurate, more realistic view of what mental health services are, how you can take advantage of them as a consumer so that you get the most bang for your buck, so you get the most out of your professional that you're working with. This is a professional, non-professional service. Every week on YouTube. Welcome to UnShrink Me. This week's episode is going to be special because we're going to talk about a very big topic that doesn't get a lot of attention, though it's probably foundational, and I probably should talk about it more, so that's why it's going to be the focus today. And we'll talk about some tweets that have shown up in the last couple of days that are very important, and we'll mix that in with the main topic. And who knows, maybe there'll even be a joke at the end. So if you find this helpful, interesting, or even funny, please feel free to like, share, and subscribe. I really appreciate you all coming out to chat, to comment, to ask questions, to share your opinion. All of it is very helpful and welcome every week on Saturday. So please share as much as you can. Comment and be part of, because I want this to be more of a discussion than anything else if it's possible. So thank you all for being here. And as always, UnShrink Me is not N-O-T, not sponsored by Celsius. However, I do love this stuff. I think it's great. And away we go. So this week's topic is a big one. It's actually a very important one, even though it's almost never discussed on Twitter, Instagram, YouTube. Almost no one who is super famous and popular talks about this. I've never once heard, big thinkers or whatever, popular people like Andrew Huberman or Jordan Peterson or Joe Rogan or any of the big podcasters actually talk about this, any of the health influencers. I've never really heard them talk about this. So I think it's a very, very, very important thing to discuss, to be quite honest with everyone. So The main topic for today's podcast, and then if anyone wants to pitch in and share other things, I'm certainly happy to kind of divert as needed. But the main thing that's super important for today is what exactly is mental health? And the reason this matters, just so everyone's clear, is until you have a good working definition of mental health, then you don't really know what you're shooting for in therapy and psychiatry and counseling, couples counseling, family therapy. Like, what is your goal? And what is your goal based upon, right? And so it's really, really important for everyone to be super clear that unless you have a coherent definition, a definition that makes sense on the whole, like big picture, macro, and micro, then you're shooting for something nebulous, right? So like feel better is about as bland and broad a goal as possible. Because feel better could mean feel better in the next 5 minutes, or it could mean feel better over the span of the next month, or it could mean feel better when tragic things are happening, or it could mean feel better when your life is difficult, or when your life is easy, or both. Feel better is a terrible goal. It's not very specific, right? And so being specific about what mental health actually is a conversation that very few people are willing to have, I think. And so I'd like to start having that conversation today with you. And then I'd love to hear anyone who's here chime in about this, because I might be wildly off base or I might be on point. I don't know. We're going to find out. So let me sketch out the territory real quick before I dig into anything specific. So I want to cover a couple of tweets, and then I want to talk about the 3 types of definitions of mental health that I believe are the most commonly adhered to by professionals. Okay? So that's the order of operations so far. So first and foremost, let me start with, first and foremost, one of Nick Tabor. Nick Tabor I've talked about a number of times in this podcast. And so let me start with his tweet as the jumping off point for this conversation about what exactly is mental health. I'll just post this real quick. And if you don't know who Nick is, sorry, extra steam in the sauna today. Nick is a skeptic or a critical person of mental health services, especially for kids. His handle is at NICKTABER on Twitter. Okay, so 1 hour ago, fortuitously, without knowing this was going to happen, Nick sent out this tweet on Twitter about an hour ago. And here's what he said, and I quote, "Let me see if I have this right. Kids are trapped in a toxic school system and family, comma. Then we give them a chemical lobotomy, psych meds, to get them to adjust and call it clinical sophistication." So I'm going to say this one more time because I think it's important. Excuse me. So he said, "Let me see if I have this right, colon. Kids are trapped in a toxic school system and family. Then we give them a chemical lobotomy, meds, to get them to adjust and call it clinical sophistication." So the reason I'm starting with this particular tweet, which is very provocative, is because it speaks to a common problem, right? So one of the problems is most of the time when people think about mental health, they think about one individual who is sick or broken, who needs to be fixed or healed. But what's often missing from the conversation about what is mental health is the system around the individual that we call sick or broken. So the truth of the matter is that none of us get sick alone and none of us get healthy alone. All of us need support to get better, right? Now, maybe that support is ordinary support, like normal support, like family and friends and church and community and the gym and all these things. And maybe the support is extraordinary. It's clinical support. It's psychiatry. It's clinical psychologists like myself. It's counselors. It's marriage and family therapists. It's all these things. So depending upon the type of problem, the severity of the problem, the conceptualization, how we understand the problem, you might need ordinary support or you might need extraordinary support. But not even getting deep into that particular fight, I want to talk about the fact that what Nick is emphasizing is that part of what makes people quote unquote sick is their reaction to a system that is bad for them, right? So he says it's a toxic school system, and I think he also means that it's a toxic family. And so the truth of the matter is, many kids in particular are in messed up families or messed up schools. And the truth is, schools aren't supposed to be bastions of mental health. It would be ideal if school teachers could be excellent educators and excellent therapists or something, but they're not. And unfortunately, they're usually neither. But the idea that your social circumstances, your environment can make you maladjusted is 100% accurate. So when we think about what exactly is mental health, we need to not just be thinking about the individual, we also need to be thinking about how the individual functions in a context, in a system, in a family, in an environment, right? It's the difference between having something wrong with you versus having nothing wrong with you, but being in a sick place that's hurting you, right? So I appreciate Nick for this particular tweet because what it speaks to is this very common problem. People confuse being mentally healthy with being well adjusted to a sick environment, right? So let me walk through the 3 common definitions of mental health that practitioners like myself and others use. And then I want you, the listener, the consumer, to decide what makes the most sense. And I'll share my opinion as well. Because this is an open debate. There is no, just so everyone's clear, and I'm going to say this as clearly as possible, there is 0 perfectly defined operational definition of mental health. There is no authoritative governing body like the American Psychological Association, the American Psychiatric Association, the World Health Organization, whatever. Like, no particular authoritative body has a perfect definition of mental health, just so we're all clear. Just like there's no objective definition of actual medical health either. So we'll get to that. Steve Anthony is here. He says nature or nurture. We can talk about those 2 influences as well. So let me talk about the 3 definitions of mental health first. So generally speaking, in most clinical psychology, like graduate level textbooks, we talk about 3 different sets of criteria, basically, that people think about for what defines mental health. So the first definition is the one that I think everyone in the world can kind of get behind, which is mental health is synonymous with the absence of severe distress or the absence of consistent impairment across time and circumstances. So the absence of severe distress and impairment, right? So you have some difficulty in living that causes either or severe distress or impairment. So mental health equals basically a lack of distress and a lack of impairment. The freedom from distress and freedom from impairment. So that's definition number 1. Definition number 1 of mental health is freedom from distress plus freedom from impairment. But there's lots of problems with that definition of mental health. So let's move on to the second definition of mental health, right? So the second definition of mental health, which I think is also fairly common in graduate school, like where I teach, is where the person can manage and tolerate distress and impairment, right? So it's not freedom from distress and impairment. It's the capacity to withstand the vicissitudes of life, the challenges, the ordinary and the extraordinary challenges of life, right? So you're a mentally healthy creature if you're capable of taking on the normal things that come your way, but also the extraordinary things that come your way with support and resources. That is what some people call mental health, right? So definition 1, freedom from distress or impairment. Definition 2 is not necessarily about distress or impairment. It's about your capacity to withstand and overcome and function just fine despite ordinary and extraordinary, circumstances. So those are the first 2 definitions of mental health. And then I think the third definition of mental health, which is what the gurus and the coaches put out there, is that you will have an optimal life despite your circumstances. So it's this optimized, you're going to be happier, you're going to be more successful, you're going to be more productive, you're going to have more energy, better mood, better sex, more fun, better friends, better relationships, despite all the vicissitudes of life. So there's like optimal, managing, and freedom from distress and disease, if you want to think about it. So these are the three common definitions of what most people consider mental health. And each of these three definitions has serious problems for unique reasons for each of the particular definitions. So I'm going to get into that in here in just a second. And again, thank you to everyone who's here watching and listening. And feel free to chime in at any time. So the problem with definition number one, which is freedom from distress and impairment, is that most things in life are some mixture of good and bad, right? So relationships, friends, work, family, physical experiences are some combination of good and bad, which means that some degree of distress is ordinary. And so we should never wish that we have a life that's perfectly free from distress, because that would be unusual, I think, to some degree. Also, freedom from impairment. So think about why that could be a problem for a definition of mental health, because if you look at almost everyone who's ever existed has experienced some degree of impairment in life, right? Some people have impairments because they're not super smart or not super extroverted and good at talking to people. Some people have difficulties with numbers. Some people have difficulties with being creative. Some people have difficulties with social cues, like autistic folks. Like, there's so many different types of impairments that people can have just by chance, not because they did something wrong or something bad happened to them. Right? So freedom from impairment and freedom from distress, I think, are incomplete criteria and also unrealistic goals if you take them as ideal. Because we're going to have some distress. That's normal, because life is full of challenges. Also, we're going to not be perfect, right? No human being is perfectly extroverted, perfectly sexy, perfectly smart, perfectly socially capable, perfectly intelligent, and in musical ways and mathematical ways, perfectly good with their body, perfectly eating the right thing. Like, no one is everything, good at everything. So freedom from distress and impairment is kind of an oversimplified, not sufficient way of looking at mental health. But are some people extremely distressed and extremely impaired? Yes. So for them, less distress and less impairment might be a really good thing. Now let's talk about the problems with definition number two, which is basically what you could call resilience. So the mental health is the capacity to withstand the normal and the abnormal vicissitudes of life. The normal and the abnormal distress, the normal and the abnormal challenges of life. Good challenges and bad challenges, right? Now, the reason that this is not a very good definition of mental health is because although you might have the capacity to withstand distress and impairment, you might still be miserable. You might be miserable. So like a lot of people with disorders like persistent depressive disorder might seem relatively normal. They might actually be functioning. They might have a job, a family, a spouse. They might be functioning very well, but they might be super miserable despite looking like they're functioning and resilient to all sorts of distress and impairment. So I think the resilience definition is not exactly, I think, a super sufficient criteria for mental health. Hoorah, says Phil. Good to see you here, Phil. Glad you're here. And then the third definition, which is the optimized version of mental health, where it's like you're actually excelling and growing and improving and all this stuff despite your circumstances, despite impairment, despite distress, despite your personality differences, your IQ differences, your cultural issues, right? So like this version of mental health is also pretty fanciful. The reason I have a problem with this one is because the idea that the average person is supposed to live some kind of optimized life is bullshit, right? So there's just a lot of like noise online. There are many health influencers. There's the Joe Rogan types and the Chris Williamson types and the Jordan Petersons and the Dr. Cam Maximus, who's one of my friends. There's a lot of these folks out there who are talking about living a more optimal life. And on the one hand, that's perfectly laudatory. That's a good thing because we should always be striving for better to some degree, because I think we have the capacity and the privilege to do that in many cases. And we should never give up. I agree with that too. However, it's also the case that some people's circumstances are abysmal, right? Or some people are just average. They're average IQ, they're average in their attractiveness, they're average in their social skills. And this idea that you're supposed to be above average, or that you will have a better life if you strive to be above average, is actually horseshit. Excuse me. And the reason it's horseshit is because the vast majority of people who have an average life where they have enough food to eat, enough money to pay their bills, enough friends, enough sleep, if you just check all the boxes of like you have enough of these things, you're doing better than billions of people on the planet, because billions of people are starving, billions of people have no electricity or clean running water, right? So like your life is actually extraordinary if you're just checking the basic boxes. So a lot of people are taking for granted, for instance, the ordinary blessings they have, if you want to think of it that way. So I think this this optimized view of life is also not mental health. It's actually a grandiose view of mental health, I would agree, or I would say. So those three definitions of mental health each have their problems. So then the question is, what is a better definition of mental health? So if we take the three definitions that are commonly used in graduate psychology and psychiatry, and clinical psychology and psychiatry, which is freedom from distress and impairment, achieving one's goals, and resilient to ordinary and extraordinary distress, or some kind of optimal thing. If we just destroy those for a second, I would challenge anyone who's listening, whether you're a patient or a family member of someone in therapy or rehab or whatever, or if you're in the profession like me, if you're a medical professional of some kind, I encourage you to think about mental health from a different perspective, a slightly different perspective. So for those of you who have been following me for a long time, one thing that you might notice is that my handle has changed on Twitter. So I used to be at Dr. Patrick Lockwood. Now my handle is at Alobha Patrick, at ALOBHA PATRICK. So Alobha means non-attachment. So Head Market Room said, why am I obsessed with being clean? I will come back to your comment in just a sec, but let me get through this other definition of mental health first. So a lot of people in the mental health sphere really don't have a guiding philosophy other than what is normative in the literature. And I want to get to a different definition of mental health because I think a lot of people are basing their concepts of mental health on some outdated medical model. So like, for instance, I'm going to talk about a tweet and then I'm going to talk about my definition of mental health here in just a sec. So I guess his name is Om Prakash and his handle is at Om Psychiatrist at OMPSYCHIATRIST. So he said, psychiatry doesn't hide behind scans. We diagnose these conditions through listening, insight, and judgment without the help of biomarkers or imaging. That's not a weakness, that's clinical mastery. And the truth of the matter is, that's not true at all. Okay? That's not true at all. And so let me just retweet this real quick so I can make sure everyone sees what I'm talking about. So when Om, I think it's Om, I'm sorry if I'm saying your name wrong. When the psychiatrist said, we don't hide behind scans, that's actually not technically true. Because the truth of the matter is that most of the models of diagnoses that we have are built on some bad combination of self-reported symptoms on symptom measures and things like that, like the PHQ-9 for depression, which are terrible, by the way. And then what we think that correlates to with some biomarkers like too much serotonin, too little serotonin, too much depression, too much depression, too much dopamine, too little dopamine, white matter, too little of it, too much of it, all this stuff. So most psychiatric definitions are built on some understanding of how the brain should work with what the person subjectively reports their symptoms are. And so Ohm is lying, literally. Now, I don't know if he's intentionally lying, but it's the truth that people are hiding behind scans, PET scans, fMRIs, spinal taps of biomarkers like serotonin metabolites and things like that. Like, it literally is trying to justify subjective experiences with biomarkers, brain scans that are all over the map, by the way. If you look at the neuroimaging data of depression, OCD, PTSD, it's very variable. No two depression brains look alike in an fMRI or a PET scan. None of them. So just take that with a grain of salt. So mental health is a little bit more than just what your brain does and how it does it, if that makes sense. It's different than just serotonin levels, because serotonin levels change all day in response to stressors, food, diet, caffeine, etc. So biomarkers for presence of a neurotransmitter or not, brain connectivity patterns, activity patterns, density of white matter or not, these four things are exactly what psychiatry hides behind all the time and then justifies with subjective reports of patients. So Ohm's a liar, probably unintentionally, but he's a liar. So what I will tell everyone is that mental health is not how your brain functions. That's a very terrible general definition, right? And the three other definitions I gave, which is freedom from distress and impairment, or resilience despite obvious normal and abnormal distress and impairment, or optimization, all three of these definitions are terrible too. So the medical definition is terrible, and the three ordinary definitions in clinical psychology are not sufficient. Let me just catch up to the comments here. Willow says, just because biological markers are typically not available, which is true. If we could scan for it, we would. Also true. Steve Anthony says, I used to live with a mental health professor, I guess. So I will come from my observations from that perspective. Great. And then Willow says, Jonathan Shedler, who I think is excellent. His analogy of depression as a fever is great. And so for many people, depression is a fever, right? Metaphorically, but that's a metaphor, right? It's an analogy. And so the fever, just so everyone's clear, the fever in basic medicine, I'm not a physician, so don't sue me or whatever, but the fever is actually your body's attempt to kill the germ inside of you. The fever is an adaptation to a pathogen. So in Shedler's analogy, the depression is like the sweating that happens as a reaction to some other pathological thing happening inside of you. So the depression isn't the pathology per se. It's a reaction to something, right? Which brings me to my definition. Now, when I say my definition, I don't mean I'm some brilliant guru who's figured this out. I'm just saying this is a somewhat more broad and functional definition than freedom from distress and impairment, or resilience, or optimization, right? So it's not so stupidly specific as all the psychiatric definitions of, biomarkers and that crap, which is not reliable or predictive. And it's not so nebulous as these other three definitions. So here is my version of what mental health could be, right? This is what it could be. This is not what it is necessarily, but this is what it could be. So to me, I think mental health is synonymous with non-attachment. Or if you want to think of it like it, from the Buddhist perspective, it's kind of like the Four Noble Truths, right? So if you're not familiar with the old school Buddhist perspective, The Four Noble Truths are as follows. And this is my very Western, I'm not a Buddhist, whatever. I've been studying and practicing since I was like 20 or whatever, but I'm not a real Buddhist of any kind, right? So I'm an academic Buddhist or whatever. So the first of the Four Noble Truths is that life is suffering. Okay? That's the first one. So the first one's challenging because most of us would, I think, wishful thinking, like to believe that life is possibility, life is uncertainty, life is opportunity, life is all these other things that are either more neutral or more positively valenced. But in the Buddhist perspective, life is suffering, right? Not in the pessimistic version, but in the unsatisfactoriness, right? So it is the ordinary state of affairs to suffer. That is the Buddhist perspective. The second of the Four Noble Truths is that the origin of suffering is what they call attachment. And that's why I changed my Twitter handle to alopa, which is not attachment. So what do the Buddhists mean by attachment or clinging to, right? So when people are clinging to something, it's like, I'm clinging to this can. So I'm clinging to this can because I have a goal. So I'm going to grasp something that I believe that I want. So I believe I want to take a drink. So I will grasp this thing to satisfy my thirst or my energy needs or whatever it is. Okay? So clinging to or grasping, it's holding on to something that you are choosing to hold on to, or you're conditioned, right? So life has conditioned you to hold on to this thing. And then there's the cessation of suffering, which is the third noble truth, right? So a lot of people mistakenly believe that they have to hold on to the can. But the truth of the matter is, if I make the choice to hold on to this can for 5 minutes in this position, at some point, I don't know if it's minute 1 or minute 5, I'll get tired, right? And so I have a choice to put down this can at any time. So the truth is, I will suffer. I'll suffer because I choose to take a drink, or I choose not to take a drink. I'll suffer because I choose to hold up the can or put down the can. No matter what I do, there will be some unsatisfactoriness in my life because my body, my mind are conditioned by nature to want things and need things, right? That's noble truth number 1. Noble truth number 2 is attachment. Noble truth number 3 is the idea that there's an opportunity to get rid of the attachment to the non-clingingness. And then noble truth number 4, at least in Buddhism, is the Eightfold Path. Right? Now, I'm not going to spend a lot of time today, etc., because this is not a Buddhist podcast or whatever, but like, I'm going to speak metaphorically about the fourth noble truth, right? So the fourth noble truth is that there's a path to the cessation of suffering. Now, the fact that it's a path, which means that it's something that you do over time. It's a journey. It's something that takes time. Excuse me. It's not something that happens. You're not a one and done, right? So the difficulty of life can end as we further ourselves on this journey towards these eight noble path choices, right? These ways of living. So there's all these different, eightfold path things you can do. So like right living, right livelihood, right mindfulness, all these things. And I'm not saying that these specific things, these 8 things are what everyone needs. What I'm saying is that mental health is when you're aware of 1, 2, and 3 as one concept, right? So the first 3 noble truths is that we suffer because we attach, because we cling to how things should be. It's the disease of should, right? When in reality, should is completely subjective, narcissistic, and about us and not about the reality of the greater cosmos and how things actually work. Because we can't actually comprehend how everything works all at once. If we could, we would be more mindful or non-attached probably. So to me, my definition of mental health is 2 things. It's noble truths 1, 2, and 3 plus noble truth 4. So I clumped 1, 2, and 3 together, which is we suffer because we attach, because we cling to. whether it's depression, PTSD, OCD, whatever it is. And noble truth number 4, is there is a way of living, which is a journey. It's not a one and done thing. It's not a pill. It's not go to the gym. It's a complicated series of things that we all have to do to attach less, right? So that's what I think mental health is. It is the recognition that we're designed to attach, to cling to, and that we have multiple things we can do to be less attached. That's what I think mental health is specifically. And so you're mentally healthier when you're further down the path, when you're trying harder to attach less, if that makes sense. To cling to how things should be, when you should on yourself less. Now I'll expand more on that, but I want to get to the comments because a lot of people have said some stuff here and that's super cool. So Head Market Room says Buddhism has its roots in the yoga tradition. Absolutely it does. And so Steve Anthony says, so I am conditioned to want to post the most posts I can to be number one. Absolutely. Willow says, it's just fundamentally difficult and painful for any organism to resist entropy. It's true. That's that's how we're designed. That we're designed to resist. And so that's why we have to practice non-attachment. Darren McGee says, I think of it as feeling okay and functioning well and recognizing there will be different levels of okay in different situations, which is non-attachment. That there is no one way we ought to be. There is no should. Willow says, Martha Stark's refusal to grieve and unrelenting hope is somewhat similar. I like it. I've never heard of that. I'd love for you to share more or share a link or something like that. That would be super cool. So yeah, I think it's really important to be clear that I'm not saying my definition is perfect or something like that. However, I can tell you both as a professor who's tried to live and breathe the literature on this in terms of treatments and outcomes and all this stuff, but also as a practicing clinician, as someone who's done the work for, over a decade, I would say that this very simple two-part definition of mental health, which is recognition that suffering is clinging to how it should be, right? How you wish it to be, what you believe it should be, plus the various types of things. So if you want to be technical about the Buddhist perspective, the eightfold path, you have to do different types of things to not cling to, right? So it's not a simple thing to stop clinging or to cling less, if that makes sense. To grasp less. To grasp less requires different types of knowledge and wisdom and mindfulness and right living and all these things. And so it's not super simple, right? So recognize that mental health is both a combination of awareness of what you're clinging to and why you're clinging to it, plus the fact that clinging is suffering, plus the various types of things you have to do to cling less, essentially, to be more mindful, to live more in a way that honors your principles. All these kinds of things, these two polarities are what keep people in a state of mental health as I understand it. However, I want to scroll this all the way back to the very beginning and say, I don't think that the concept of mental health is a good concept. And the reason I believe this is true, despite everything I've just said, is that it implies that there's some way of living that is objectively healthy, and that is not true. Because the truth of the matter is when it comes to your mind is ever changing. Your circumstances are often changing. And so there is no objective criteria to ride the wave, so to speak. If you have rigid criteria, they will snap and break. So there's a flexibility that's involved in mental health. There's a cognitive flexibility, if you will, if you want to be all act about it. And so what I will tell everyone is that the people that are clinging to a perfect definition of mental health or freedom from distress or whatever it is, you're going to be miserable. Whatever it is that you actually cling to will cause you misery. So Steve Anthony says, when I approached it, I said to myself, who am I and why do I do the things that I do? Asking yourself these questions is valuable, I think, Anthony or Stephen. I think that's a very valuable thing to do. But the problem with asking why is we can also get stuck in clinging, if that makes sense. So we need to make sure we don't get stuck in clinging, in my opinion. Now, I want to talk about another post as it relates to this because I want to make sure that everyone's clear that I'm not just pitching Buddhism here for mental health. I don't think anyone, in at least a Western context, has the time, the energy, or the bandwidth to become some kind of Buddhist or whatever. What I'm pitching specifically is a very simple idea, which is this correlation, which is the more we cling to, the more we expect, the more we believe that things should be a certain type of way. I should feel happy. I should be free from pain. I should be more successful. I believe I need to. I have to. Whatever it is. The more you're attached to that way of thinking, the more miserable you will be. And if you look at most diagnosable mental illnesses, PTSD, generalized anxiety disorder, major depressive disorder, borderline personality disorder, narcissistic personality disorder, substance use disorders, all of these are disorders of should. Every last one of them. Now that's an oversimplification, and I know that's a guru kind of thing I just said. So what I'm trying to say specifically is that these are all disorders of clinging to how we should feel or not feel. And the truth of the matter is, there is no objective basis for how we should feel. Zero objective basis. And I'm not exactly some woke postmodernist. I'm just telling you, literally, that should is the enemy, because should is based upon some arbitrary, egotistical criteria. It's not based upon a full understanding of your life, your genetics, your metabolic needs, your social context, your sick family, your sick culture. It's more complicated. To be a real person and to truly respect yourself, you need to fully acknowledge all the differences that you inhabit and occupy, whether it's cultural, whether it's intellectual, personality, genetic, family systems, it doesn't matter. Whatever your differences are, these are the constraints of your mind. Darren McGee says it's often a fear of the feeling rather than the fear of the thing itself. Yeah. Fear of, which is an expectation. It's a clinging to what you should feel or not feel, right? And all of the pseudosciences, like clinical psychology is a pseudoscience, by the way. Psychiatry is a pseudoscience. There is no pure biological basis. There's no objective basis for anything in clinical psychology. Nada. Zilch. There is no clinical, objective, reliable basis for anything in psychiatry. Nada. Zilch. Life is dynamic and dialectical. The human mind is dynamic and dialectical. It's an evolving, changing thing. The mind is, analogously, the mind is closer to an ecosystem, which is why you need the Eightfold Path. You need multiple different types of things to balance out that ecosystem. So in life, an ecosystem needs water and bacteria and fungi and plants and animals and sun and all these things. Human minds are like an ecosystem. There's a couple of comments here that are just fascinating. So Willow says, relationally, this is powerful as well. My partner should understand me. They should know what I want. I should love madly and feel perfectly loved. That's not true, but it makes perfect sense because shoulds destroy us, right? So it's not that standards are bad in relationships. It's that when you cling to how things should be, you will be miserable, right? That's why the Eightfold Path is great. That's why the Four Noble Truths, at least metaphorically, if you clump 1, 2, and 3 together and 4 separately, you understand that mental health can be the simple understanding of clinging to is misery, plus you have to do a bunch of different things to cling less. You have to have right livelihood, right mindfulness, right living, right principles, all these things. Willow also says, very insightfully, maybe mental health is just the depressive position. So I disagree with that because the depressive position is essentially a way to not grow up, essentially, to grapple with the entire weight of life. Now, that's a psychoanalytic discussion for people who are actually interested. Come at me on Twitter. My handle is at AlobhaPatrick, ALOBHAPATRICK. Come tweet at me about the depressive position. We can battle it out there. But no, that's the coward's way of going it, but I'm glad you're joking. That's what the therapists do. The therapists are mostly depressive position people. They're cowards who are afraid of getting all their needs met in real life, so they hide behind the veil of therapy. You know what I mean? So what I will say is, again, mental health is complicated. Aren't we all scared, Willow? Yeah, I wish I'd known is more realistic than I should have known. And I agree with that, Darren. That's what Darren said in this chat here. However, when you say, I wish I had known, that's also a clinging to about what should have been true. But the truth is, it doesn't matter if you should have known. It matters what you know now and what you're willing to do now, right? That's the beauty of being mindfully present in the Buddhist sense. You're not really clinging to the past or to the future. You're clinging to the here and now. What do I know now? What do I believe now? What is possible now? What am I willing to do now? What could I do now? What do I want now? Right? Right now. Because right now, in the Buddhist mindfulness sense at least, is all we have, right? And pretending that we actually know the future or pretending that we could have acted perfectly in the past is delusion. It's attachment to, it's clinging to. And that's pathological, So what I will tell everyone is that the ordinary definitions of mental health that most therapists learn, unfortunately. Now, I try to teach my grad students differently, but it's hard because I'm trying to condition people against 20 years of being alive, 30 years of being alive, especially in the West. And most people wish that mental health was as simple as freedom from illness, freedom from distress or impairment, or just being resilient when bad stuff happens, ordinary or extraordinary. I wish it were that simple. But the truth of the matter is, if you just take the simple perspective of freedom from distress and impairment or resilience despite distress and impairment, you're still going to be miserable because you're still going to be clinging to how things should be. And the truth of the matter is, none of us know how we should feel. None of us know how life should go. It is wild arrogance to believe that you know how you should feel. Now, does that mean that I believe that people who are absolutely miserable should just be that way? No. I am not so arrogant to believe that I believe someone should be miserable, right? That's not what I believe. So this is not some fatalistic, well, I guess people are screwed kind of discussion. This is a more neutral, it's extremely important to be open to how things could be because you don't know how they could be. And Head Market Room just said something that I want to capitalize on here because it's extremely important. I want every family member, every patient to hear this. Head Market Room just said, I've had very bad experiences with psychiatry. It seems like they want you to be mentally ill. It's nice to hear your take on it. Quality. Thank you. So I want to speak to what you just said, though. They want you to be ill. So psychiatrists and psychologists sometimes explicitly want you to be ill because they have preconceived notions about how you present, right? So if someone shows up to me and says, I'm having terrible withdrawals, I just drank a bunch and I feel miserable, then that objectively seems to me, at least, like you're having withdrawal symptoms. That's probably going to suck. And that's an ordinary consequence of drinking too much, right? A hangover, for instance. Now, do I want that person to have a hangover? No. But if you describe to me the symptoms of a hangover, I'm going to probably agree with the basic definition of alcohol withdrawal, if that makes sense. So in that perspective, I don't want you to be sick. However, there are many professionals. So I want every family member to hear this. There are many professionals who are not super healthy, who do not understand their own issues, their own wishes, their own hurts in childhood and stuff. And because of those injuries and those wishes, they will take that out on the patient. Because some professionals feel very powerless themselves, and they would like to have power over people who remind them of themselves. A lot of professionals go into the profession because they're damaged themselves, wounded healer. And then they seek out people to treat who are sick like they are because they want to help them. But many of these professionals are not aware of the fact that they have to treat you as if you are sick and see you as sick, but you might be substantially different than them. And that means you may be less ill than them. To go back to Nick Tabor's post, sometimes you're not as ill as you seem because you're in a very sick environment. If you're being physically abused, if you're in an intimate partner violence situation, you're going to have all sorts of reactions to that. And you might look sick, but maybe your reactions make sense because you're being hit every day or screamed at every day, for instance. And that's not the same thing as having a mental illness, right? So some professionals are really sick. Some professionals are very ignorant, and they do want patients to be ill because it serves a need for the professional, not just cynically to make money, but it serves a psychological need for the professional, for you to be sick and for us to be able to help you because it feels good to help you, right? And there's a lot of that in the industry because many people who come into the industry, psychiatrists, psychologists, MFTs, LPCCs, whatever the degree, a lot of people are very sick. They're very unhealed and they don't know it, or they don't see the full extent of it. And so they don't see the ways in which they would like for you to be sick so they can have some power over you or have some distance from you or get some need met with you that they can't get met in real life with their friends, family, lovers, and so on and so forth. So I hope everyone heard that clearly. Willow said, is this non-attachment close to Stoicism? No. Although Stoicism borrowed a lot from Buddhism and all these things, this is very different because Stoicism is closer to like, don't attach to anything, just deal with it. Just grin and bear it, you know? Excuse me. But non-attachment is like neutral. It is. It just is. Whatever my reaction is, it just is. Whatever's happening, it just is. I can choose to attach to it or I can choose not to, right? And it's through that awareness of the capacity to choose or to notice the reactions that allows us to cling less, right? And we can use the eightfold path to, develop new habits, rituals, routines, attitudes to cling less. Head Market Room says, great, thanks. Hearing that helps me a lot. Of course, absolutely. Willow says, my motivation to get into psych is absolutely overdetermined, but at least one part was that I wasn't heard as a child. Depressive position. Thus, it became very important to be heard. I am aware of that and I'm working at that. Willow, he says, going on, ensuring that I don't allow that to overly influence my work as best as I can. Willow, I'm so proud of you. I don't know you. I don't know your real name. I don't know who you are. Maybe we know each other. Maybe we don't, whatever. I'm so proud of you for saying, this thing happened to me as a kid. It drove me into the profession to some degree. And I'm trying to be aware of it so I don't take that out on patients, so I don't enact this with my patients. I'm so proud of you for doing this, for being clear about what might have pushed you in this direction and taking ownership of it so that it doesn't interfere with your work and that you can have a better, more quality, more objective relationship with your patients. Head Market Room has to go. Have a nice day yourself. So I want everyone to understand that it's really hard in a modern world that we live in with all the distractions and technology and goals and hyper productivity and hyper capitalism and all this stuff to achieve this quasi-idealistic thing I was talking about with the Four Noble Truths, right? Suffering is life and is ordinary. Suffering is ordinary, number one. Number two, that the cause of suffering is attachment or clinging to. And number three, there's a root there's a path to cessation of suffering. It is possible to suffer less, right? So those three things are part one of definition of mental health, which is awareness of what the problem is, which is attachment to suffering, or attachment to, which leads to suffering. And part B of the definition is there are a lot of things you could do that you might need to do to attach less, to cling to less. Willa says, thanks, doctor. Of course, absolutely. Shout out to anyone who's trying to do the right thing. I always want to encourage anyone who tries to do the right thing. And I'm proud of you for trying to do the right thing because it's hard. A lot of people would rather not do the right thing. A lot of people would rather just be lazy or ignorant or in denial or rationalize. So many people, especially in the depth psychology world and the psychoanalytic world, just rationalize their pathology into like positive pro-social motivations, which is shit. So mental health is not freedom from distress and impairment. Mental health is not resilience despite problems, ordinary or extraordinary. And mental health is not some kind of optimized living influencer Silicon Valley bullshit. Now, striving for those three things, if you want to strive for those three things, that's totally fine. But most people I know that strive for any of those three things is usually still miserable. My experience has been, both as a professor and as a clinician and as a consultant, is when you push towards non-attachment, it's a little easier to be aware, open, present, and surf whatever happens, surf the waves of whatever's happening without misery. More open to joy, more open to sadness. Lauren Steitler is here. He says, hello from the road to LA. Well, hello, Lauren. Good to see you. For those of you who don't know, one of my good buddies is Lauren, who is a brilliant doctor of traditional Chinese medicine and just a solid person. One of the smartest people I know and one of the most thoughtful people I know. And I'm just glad he came to say hi. So drive safe. And it's hard to be healthy because healthy is this Western objective thing. And I don't encourage anyone to strive for this Western objective thing we call health. I think health is a terrible concept. The fact that it's called healthcare is terrible for all of us, in my opinion, because it presumes there's some objective ideal way of being. And in all of my years of being a clinician, in like 16 years of being in the industry, I have never once met someone healthy. I've met a lot of people trying to live a better life, but I've never met someone who's healthy. And it's not because everyone I meet's terrible or sick. There's probably some selection bias or convenient sampling here, but like healthy is a terrible goal. Just like happy is a terrible goal, healthy is a terrible goal. Less attached, that's probably a better goal. That's probably a goal that's going to make you less miserable over time. But it's not idealistic. It's not big. It's not sexy. So what I'm selling is not sexy, but it works. I'm a pragmatist. It works. So my encouragement to everyone is to do more of what works. So if you're striving to be less miserable and that's what's working for you, God bless, keep doing it. But if your therapist believes sincerely, if your psychiatrist, whatever, believes that freedom from distress is the goal, then they are naive at best and stupid at worst. If your therapist, psychologist, psychiatrist believes that, resilience is the goal, then they are just repeating something they heard on Instagram or whatever. Because the truth of the matter is resilience is not a one-dimensional linear thing that you can just become resilient and you're going to be fine. We have to constantly work to be quote unquote resilient. We have to go to the gym and work out or run or do yoga or Tai Chi or whatever it is. We have to do things. We have to be actively involved in multiple different types of attitudes and physical activities and patterns and habits in order to be quote unquote resilient, which brings us back to the Eightfold Path, right? In order to actually cling to less, to attach less, to should less, you kind of have to do a lot of different things. It's not just meditate. I met a lot of people who meditate and they're miserable pieces of shit. So I encourage everyone to look at mental health as a terrible concept, number one, and maybe just focus on clinging to. Not because the other definitions of mental health that I mentioned today are wrong. We just don't have good empirical support for any definition. So I'm offering a philosophical approach that can be achieved through most types of therapy, spiritual counseling, whatever it is, that allows you to actually achieve something that is robust, against time and circumstances. Because we're always going to be stressed out. Stress is always going to happen. Bad things are going to happen. Good things are going to happen. The question is, what is the quality of the mind that you want? Do you want the quality of mind that is pushed and pulled by how you feel? Or do you want to surf? Right? Do you want to surf the waves of your feelings? That's up to you. Right? It's subjective. So for me, I think the ordinary definitions of mental health, the three that I talked about, which is freedom from distress and impairment, resilience, or optimization, all three of these are fine. And you can strive for them. I just don't know that you will be ultimately satisfied because life is ultimately unsatisfactory, right? So that's my approach. Take it for what it is. If you disagree, I would love to hear in the comments. If you like one of the other three definitions more and they've worked for you, I'd love to hear about that too. Unfortunately, we're at our time today. A lot of people came out to watch. A lot of people came out to comment and chat, and I'm really grateful for that. Thank you all. There's just tons more to say. There's so many tweets I want to get to, but I just don't have time today. I'll get to them next week in the new year. 2026 is coming up. And so, as always, please like, share, and subscribe if you think this is helpful, interesting, funny, distressing, whatever. And, give me some feedback. I'd love to know where I was wrong, where I was off base, so that I can have a more informed, more thoughtful perspective. And as always, this is a podcast to help people get more out of their mental health professionals that currently exist. So I'm not giving you the individual specific advice. This is not me acting as your clinician. This is me just kind of ranting about what I believe is true and not true that will hopefully be informative for people who are seeking out services and thought-provoking in some cases. As always, I like to end these things with a joke. And so without further delay, here is today's joke. So I once had this patient who, believe it or not, this might shock you, but this patient was addicted to cheese. Yep, you heard me correctly. Was addicted to cheese. She was obsessed with cheese. Like she literally had the screensaver on her phone was literally a block of cheese. And so you might be thinking that's absurd. No one can be addicted to cheese. It's not a real thing. Well, let me tell you about some of the things that she went through. So she did a bunch of stuff that's clear, quote unquote, impairment, right? We were talking about earlier. Like she didn't go to restaurants that didn't have cheese. So anytime her friends or her husband wanted to go to a place with cheese, she would just literally not go. She would avoid. Or one time she was going to a movie with her friends and she snuck in a block of cheese and it stunk. And people are like, what are you doing? Another time she was at a Christmas party recently and she literally had to go to the bathroom to eat cheese secretively. Anyways, so like she's done a bunch of weird things, all related to cheese. It's the weirdest thing I've ever seen. And I get it, like I like cheese, so I'm not judging her or anything, but it's a bit extreme. Anyways, so we met for a couple of sessions, and I was admittedly very confused because, I've worked in rehabs for most of my career. So like, I get what addiction is, I think. And I think I've never in my life seen someone addicted to cheese. So anyways, she told me that she has always been fascinated by cheese, the taste, the texture, the smells, since she was very young. So apparently what had happened is that her mom owned a cheese shop and mom died tragically, unfortunately. And so she was very young, like 5 or 6. And so she had very few good memories of mom except for when she was at mom's cheese shop. So kind of, I think what happened was there's like this tragic, traumatic, like grief-based, like enmeshment of the fondness for mom and the fondness of cheese kind of merged or whatever. So I asked her, did you two kind of ever get close in a way that was meaningful to you? She said, yeah, about a month before she died, she started to like invite me over to a cheese shop and I'd hang out there. And it was really nice. I knew that my mom loved me, but I also knew that she had to work. So, she was kind of gone all the time working and I didn't get to see her very much. But, After we started to have this conversation about her fondness and her missing her mom, she actually started to relax in session a little bit. And, we started to do some grief work. And, a lot of the reason that she struggled, in all sincerity, with, this obsession with cheese is because she felt like she never got enough of her mom. However, after some good therapy, it sounds like she actually got the most out of the mom that she could have, all things considered. So I said, now that you're feeling better, would it be fair to say you had a good enough mom? All right. Have a good day. Have a good week. Take good care of yourself. Have good food. Have good sex. Have good friends. Be good to yourself. I will